Hello, my friends, and welcome back to another session with the older man. Today, my friends, we're going to talk about something that is quite personal, not only to me, but to you as well. Today, we're going to talk about prostates. We're going to talk about the prostate, and we're going to focus on masturbation. Yeah, every single man's favorite activity, especially when he's a teenager. Listen, guys, Ask an Older Man, this isn't just a relationship channel. I want to make sure that I cover all the aspects of helping men, period. Okay, this is a male's advocate channel, and I know you guys love the juicy stuff when I talk about feminism and relationships and dating, etc. But you got to understand, all of that stuff becomes very, very minor if you can't get it up, if you have health issues, if your body's in horrible shape. So that's why I focus on fitness. If you're not making any money, you're broke. So we can talk about relationships until we're blue in the face. If you don't fix these other problems first, forget about having a relationship. So one thing that is very, very vital for men is your prostate. For women, it's the breasts. Mammogram are important. For men, prostate exams are vital, okay? Women are always worried about getting breast cancer and having cervical cancer, etc. Most of men's issues are usually heart health problems, but more importantly, the silent killer, the one that most men don't realize until it's too late, is prostate cancer. And it all usually starts from a place that we don't really recognize, and that is an enlarged prostate. So I was putting this subject off because I was trying to get my urologist to come in and do an interview with me, but we could never get the scheduling correct, and it's just really hard getting him in studio. I might have to go and set up a camera for him because he's not that techie in his home, so that we can have a show. So listen, I'm going to share with you one thing, guys. I have an enlarged prostate. I have the freaking prostate of a 70-year-old man. That's not my words, that's my urologist. One thing that we all have to understand, especially as black men, once you reach over the age of 35, 40, you better go and check your prostate. You have to. When I was 36, I was diagnosed with, hey, your prostate is starting to get a little bit bigger, much bigger than it should be for your age. And at that time, I was, what are you talking about? I'm fit. I'm the fittest I've ever been in my life. What are you talking about, enlarged prostate? Of course, back then I was ignorant. I didn't understand anything about prostate issues, right? All I was concerned, I was eating right. My muscles were tight. Everything was just perfect, right? But my GP at that point, he was like my buddy, and he said, "Boss, let's check your prostate." And I said, "Well, what's that?" He said, "Well, I got to go in. Of course, as a Caribbean man, you're like, "No, that shit ain't happening. That ain't happening." He said, "All right, you could die." The reality of it is, he said, "Listen, this is no different than somebody examining your throat with their fingers or examining your other body parts." And I'm like, yeah, all right, let's do it. So anyway, he checked, the finger insertion. That's actually the best way to still check to see if there's anything growing on your prostate. And then after that, he took an ultrasound, and he said, yes, your prostate's a little bit large. And that began my journey. He said, it's not concerning yet, but we got to keep an eye on it. By the time I hit age 40, it had grown even larger, and that was when he said, listen, you need to actually start looking at going on some alpha blockers. I'm like, what the hell is that? So alpha blockers is basically pills to stop the testosterone that's in your body, because black men have a much higher degree of testosterone, and it's the type of testosterone that feeds the prostate. Let me find out from ChatGPT what type of testosterone feeds the prostate. Hi. You're obviously familiar of an enlarged prostate. What is the official name for it?
Yes, the official name for an enlarged prostate is benign prostatic hyperplasia, often abbreviated as BPH.
What is the hormone or testosterone that feeds that to enlarge it?
Testosterone and its derivative, dihydrotestosterone, DHT, play a significant role in the growth of the prostate. DHT in particular is known to contribute to prostate enlargement.
It is known that this condition is more prominent in black men. Is that correct?
Yes, studies have shown that benign prostatic hyperplasia, BPH, tends to be more common and may develop earlier in black men compared to other groups.
What percentage of black men would you anticipate have this problem once he reached past the age of 45?
According to some studies, about 1 in 3 black men over 45 experience moderate to severe symptoms of benign prostatic hyperplasia, BPH. This percentage can increase with age, reaching around 50% by the time they are 60.
Thank you.
You're welcome. If you have any other questions, feel free to ask.
You heard that, gentlemen? About 50% of black men will have enlarged prostates. That means if you look to the left and you look to the right, one of the guys next to you will probably have an enlarged prostate. And how do you identify that you might have an enlarged prostate? When you go to the toilet and you're urinating, it might find that your urine stream is not as strong as it used to be when you're younger. Okay, it's not coming out, or it might come, and then it's incremental. Because what's happening is your urinary tract passes through your prostate. The prostate enlarges and it squeezes the urinary tract. Think about something squeezing a hose. So when you actually trying to relieve yourself and the urine is coming from the bladder, it's coming out, but it's not coming strong. The problem is that your stream is being cut off by the prostate. So if you are feeling symptoms of slower stream, it's not strong, you better go and check your prostate. You have to go check it, my friends. All right? So what happened is it squeezes the urinary tract so hard that it feels like, all right, there's nothing else coming out. But the issue is your bladder isn't empty. Your bladder still has urine in it. So you have not fully discharged your bladder. So you'll start to get bladder infections because the urine is still in there. But then what happened is the bladder says, hey, you need to pee again, man. You need to pee. But you're saying to yourself, shit, I just peed 10 minutes ago. Then you got to rush back in and try to pee again because it's coming. And then the same thing happened. You relieve yourself, but not all of the urine is coming out. So what happened is you're going to the toilet more frequent and frequent. That's why most older men need to pee constantly. The saying is, you never ever cross a toilet once you're an older man and think that you're safe. Yeah. You make sure that whenever you see a toilet, you take that opportunity and go. Don't take any chances. All right? So these are all the lessons I've been getting from my urologist. So what happens is that I have to take 2 particular types of drugs. Let's ask my friend ChatGPT the name of the drugs because I can't remember. What is the most common alpha blocker to stop the problem with the prostate growing? What's the name of it, the official name?
One of the most common alpha blockers used to treat benign prostatic hyperplasia is tamsulosin. It's often marketed under the brand name Flomax.
Right, that's American brand. I know it over here as Omnic. Is that the same thing?
Yes, Omnic is another brand name for tamsulosin, commonly used in some countries outside the U.S. It's essentially the same medication.
And what is the name of the product that helps you to relax your prostate so that your urine flow will become much easier?
Tamsulosin helps relax the muscles in the prostate and bladder, making urination easier. Another commonly used medication for this purpose is alfuzacin, which also works similarly to improve urine flow.
What's the 2 most popular brands?
The 2 most popular brands for medications that help with prostate issues are Flomax tamsulosin and Urexatral alfuzacin. These are commonly prescribed to help with urinary symptoms due to an enlarged prostate.
All right, thank you. So those drugs that she described are alpha blockers. In other words, these 2 medications are designed for, number 1, it's an alpha blocker that stops the testosterone from feeding the prostate in order for it not to get any bigger. Okay? The second one relaxes the prostate so that you can urinate freely, so that you can fully empty your bladder and you don't suffer from bladder infections. Yes, gentlemen, these are the issues you have to work with. Okay? Now, here's the thing. Here's the kicker. And this is what a lot of women don't understand and what a lot of men do not understand. The alpha blockers, it also diminishes the sex hormone that you produce in order to feel horny. it sort of kills the sex drive. So most of the time, ladies, if you're listening, the man isn't impotent. It is the drugs that he's taken for the prostate that makes him impotent. But I have the cure for that, and it's coming up from a urologist, so you guys got to stay with me, all right? I know this information is a little dry, but trust me, man, you need this. Whether you're an older woman, younger woman or a young man, whether you're in your 30s, 40s, and you haven't had problems yet, you got to know this. You got to know this for your grandfather, the gentleman down the street that you don't, your neighbors that don't go to the doctors regularly, because men tend not to talk about these things. This is the problem. That's why I'm trying to bring it to you on this channel, because we don't talk about it. So, gentlemen, if you are on an alpha blocker, this will diminish your sex drive. It is not your natural way. Listen, it is not your body. It is the drug that is causing this issue. All right? So how do you counteract this? You have to stay sexually active. How do you stay sexually active when you have a woman or a wife at that age who's not giving you sex more than once or twice a month, right? When you don't masturbate, when you don't have any sexual activity, that's where your problem comes in, my friend. You have to have orgasms. That is how you combat this problem. You got to keep training the body to say, hey, even though I'm not getting that amount of testosterone going down there, I still need to produce it. And in order to produce it, you got to use it. Just remember this one simple point. Use it or lose it. Use it or lose it. Do not ever forget that. And this applies to every single part of our body. We got to use it or lose it. You don't work your muscles, you're going to lose them. You don't run, jog, your lungs are not being worked, you're going to lose the capacity for the lungs to work. Okay? You don't use your brain, you don't push yourself mentally, your brain is just going to go dead. It's the same damn thing, my friends. If you don't feel like having sex because the alpha blockers are killing your sex drive, you now have to force yourself to have sex. And that comes usually in the form of masturbation. And that's primarily how we got here doing this video about masturbation. Now, my urologist told me, 7 years ago, listen, you need to masturbate on a regular basis if you're not having sex. Thankfully, my wife and I are still okay with the sex. I'm not going to say, listen, it's never 100%. So I'm not going to sit here and BS you guys, okay? We know that every single man would love to have more sex, all right? She can't keep up with me. That's the reality of it. It's just the reality of life, man. I've not had any woman being able to keep up with enough sex that the man demands or wants, okay? It's not like she can't do it. It's just that she does her best, but when she's not there, I need to have an orgasm at least 5 times a week in order for me to stay incredibly horny. I'm a horny guy, but that's because I work in that 5 days a week. Just like I go to the gym every day or I exercise every day, I need to keep my prostate and my sex engine functioning. So masturbation is key. And if you think that I'm BSing you, let's listen to this urologist who tells you exactly what I'm saying right here. Because it seems like what my urologist, very, very skilled man, he's one of the best in the country over here that I go to. It seems now that it's starting to catch up in the West, where they're actually making videos of it. Urologists are making videos of it. So this is a urologist telling you the importance of it.
Is masturbation harmful to men of the age group 70 and above? Simple answer, no. But that's not what is interesting here. The crucial questions are, do men still want to masturbate at 70 and above? What about sexual dysfunction, which is common at that age? And what about heart health? I went through the literature and found very interesting data on a topic that still is under-researched. Masturbation is a topic that triggers a lot of attention on YouTube, especially when it involves the older age groups. I'm not quite sure why. Obviously, for many, there is still something very forbidden about a totally normal behavior. I have uploaded a video about the biological foundation of masturbation seen from an evolutionary perspective. Here's the link, check it out. Anyway, the most basic level to be learned when it comes to aging is this: everything declines. This is also true when it comes to human sexuality. This is why I don't understand how this topic spikes so much interest. Naturally, sexuality decreases with age. In 2010, results from a US population-based survey were published involving 5,865 men and women aged 14 to 94. If we just concentrate on the subpopulation of men 70 years and above, it leaves us with a number of 184. On average, 27.9% had masturbated during the past month, and 46.4% had masturbated during the past year. Just to put this into perspective, the corresponding numbers for the 25 to 29 age group were 68.6% and 83.6% on average. In 2021, Norwegian data on 4,160 men and women aged 18 to 89 were published. In this study, 342 men were older than 70 years. The numbers are quite similar. 22.5% had masturbated during the past month. They didn't ask about the past year. However, very interestingly, they were the most active age group. Only 4.5% of men below 30 had masturbated in the previous month. Now you're asking, why? I'll come to that in a second. But let's put this into perspective. Of the men who did masturbate, 17.5% of the age group below 30 years did it daily, something only 0.6% of the over 70-year-olds accomplished. In general, one would think that masturbation is linked to sexual desire. In 2020, a very thorough meta-analysis was published in European Urology Focus. They included 75 studies for analysis. Here's a box plot of that analysis depicting sexual desire in the respective age groups. As you can see, in old age, it drops dramatically, but also there is a huge variation. 16 to 80% of the men 70 years of age are sexually interested. That means individually there is great variation. Just because someone is advanced in age doesn't automatically mean he is sexually not interested. On the other hand, erectile function diminishes as one gets older. Here's another box plot from that analysis. 8 to 94% of the men 70 and older had erectile issues. Again, this is a wide variation. But from the graph you can see it's roughly 70%. Many of you may not be aware that orgasmic function is a standalone feature. Erection is not a precondition. It is possible to achieve orgasm even without having an erection. Another very interesting finding is bother. Erectile dysfunction causes quite some panic in younger males. This is not the case in the older age groups. Between 6.7% and 48% of men over 70 reported being bothered by erectile dysfunction. In men 60 to 70, it was up to 70%. And in men over 80, bother dropped to 38%. The motives for masturbation are likely more varied than you might think. And even science admits that we will have to do a lot more investigation into that topic. The Norwegian study found that there is only a loose connection between frequency of masturbation and sexual satisfaction. Another study on 2,967 men found that many men also masturbate to reduce anxiety or distress. So there is still lots to learn. But what is the take-home message for you? I think we can break it down to use it or lose it. Sexual function is likely to decline with age, and if you're not active, it will vanish forever. Activity includes masturbation. I often see patients in advanced age groups who have found new partners through dating apps. They have not been active for years, and now they are experiencing problems. Let me tell you, it is not easy to make that function work again in these age groups. There are changes in penile architecture that cannot be reversed in many patients. So masturbation is not harmful to health. In fact, it can be beneficial. But don't get me wrong here. Sexual activity declines with age. That's just natural. If you don't feel like engaging, that's perfectly fine. But as I have just shown you, there is a huge variability between men. What is desirable for one is not desirable for the other. What about the heart? The risk for events concerning the heart is low. However, this video is not a medical consultation. I advise you to talk to your personal doctor and get your heart checked anyway. This video cannot provide that.
All right. Use it or lose it. Okay? Now, the studies he is talking about is primarily how many people masturbate and how many men do it and how often. Now, of course, we are now entering a society where a lot of men are not having sex.
I pulled the Pew Study and I read with interest. Turns out since 2019, the share of single men who say they're looking for dates or a relationship has declined from 61% to 50%. In 2018, 28% of men ages 18 to 30 reported they'd had no sex in the past year, compared with 18% of women of that age. The Hill report said men in their 20s are more likely than women in their 20s to be romantically uninvolved, sexually dormant, friendless, and lonely.
So the use it or lose it principle doesn't just apply to when you're older, it also applies to when you're younger. We adapt to whatever situation that we're under. So those boys, young men that are not getting any sex, they will have problems when it's time to get it going again. A lot of it will come from anxiety, but that natural testosterone, if they haven't been to the gym, if they haven't been pushing a lot of weights and being aggressive, listen, man, shit might just not work. You might have to restart it with hitting the gym, masturbating, start looking at some porn, start getting your body active again sexually. Like he said, use it or lose it. So my urologist was telling me from day one, man, he said, don't stop. If you stop having sex, if you stop using this organ, you will have a problem. Here's another thing you got to identify when it comes to using these drugs, the alpha blockers. What it does, it just got to warn you, it will lower your blood pressure. And number two, you will not have external orgasms. Nothing will come out. I know it sounds weird. You'll still have an orgasm, but it's internal. It'll basically go into your bladder. It's kind of cool because you just don't have any mess to clean up, right? And then you just urinate. When you go to the toilet again, you just urinate. So you have internal orgasms. It just doesn't come out. So that's one thing that you guys got to note. All right. Listen, my friends, this is where we at once we reach this age. But we have to talk about it. I've had a few guys who watch my show who've called me and said, listen, man, I suffer from erectile dysfunction, ED. How can I fix it? The thing is, I can't determine how to fix it. All I can tell you is what I do to keep mine high. I hit the weights, man. I make sure that I keep my testosterone high. I feed my muscles, but the issue is the alpha blockers stops it from feeding the prostate. And in turn, I make sure that I either masturbate or I have my wife there to help me out as much as she can. And that's what keeps my sex drive at its peak. Hey, welcome to aging, my friends. If you haven't reached 58, 59 yet, I can tell you it's coming, and I hope it comes, all right? But you got to know what to prepare yourself for. And for those of you that have not been checking your prostate and understand how this thing works, please pass this video on to other men. This is vital for us. I make sure that I go to my urologist every 90 days. He checks to see if it's getting any bigger, and he also checks to make sure that it hasn't turned cancerous. Because you got to remember, prostate cancer is something that is silent and deadly. But if you catch it early, easily cured, very easily cured. Next thing you got to understand, there are really safe operations now that you can get to shave down or cut away the prostate so that it does not pinch on the urinary tract. But there's a 0.01% chance it could make you impotent. And guess who's not taking that chance? Yeah, I'm not taking that bloody chance. They say it's really safe, but man, I just like, oh no, give me the pills. I'll take the pills, man. The thought of going in and up through my urinary tract and in there and burning away the prostate, because it can be burned away now with hot water. It's a very easy operation. Let me see if I can find the name of the operation for you guys. There is a modern operation that you can do currently that involves hot water to bring down the size of the prostate. What is it?
You're likely referring to water vapor therapy, often known as Resume. It uses steam to reduce prostate tissue and relieve symptoms of BPH. It's minimally invasive and can be done as an outpatient procedure.
What are the chances of developing erectile dysfunction from that?
The chances of developing erectile dysfunction from water vapor therapy, like Resume, are relatively low. It's considered a safe procedure with a lower risk of sexual side effects compared to more invasive surgeries.
There you go, gentlemen. You now are fully informed on BPH, enlarged prostate, my friends, and the power of masturbation. So if I hear anything about the religious part and this whole spiritual thing about the spiritual energy, save your breath. Save your breath. You guys have been fed so much crap about masturbation and, getting rid of the male seed and the energy and all of this crap. Stop it. You are at a point in your life where that stuff, if you don't use it, you're going to lose it. You go and mess around with all of this crap about, I'm not letting out my energy, my sexual energy. Yeah, great. If you don't want to function fully as a sexual man, by all means, you do that stuff. You can go and live in the mountains and sing Kumbaya with the rest of the... I don't want to get out of hand, but my point is, if you still want to be sexually active, if you still enjoy sex, your 60s, 70s, and 80s, listen to what I just told you. Pass this message on. All right? So my friends, subscribe, book a session if you want more information. If you didn't understand any of this, I'll be more than happy to talk to you personally as well. Okay? So, my friends, until next time, remember, whenever in doubt, always ask an older man. I'll see you in the next one. Cheers.